Dr. Ellsworth Wareham, a legend in American medicine, was not only a leading cardiothoracic surgeon at Loma Linda University in California, but also globally renowned for his healthy lifestyle, which kept him vibrant until age 104, with minimal need for medication. What set him apart from other doctors was his focus not just on treating disease, but on teaching people how to prevent it through small daily choices like eating an egg. An egg eaten correctly is medicine for your liver, he once said. Eaten incorrectly, it becomes a burden that silently damages your liver daily. Eggs are a familiar staple in nearly every kitchen, but their familiarity leads millions to eat them wrong daily, unaware of the consequences. The concern is that these mistakes don't show immediate effects, but gradually erode liver health, leading to elevated liver enzymes, fatty liver chronic fatigue, or even the silent onset of cirrhosis. So why can eggs be both nourishing and toxic? The answer lies in three factors: the type of egg, the timing of consumption, and how it's prepared and paired. According to Dr. Wareham, when eaten correctly, eggs are one of the most valuable foods for the liver due to their content of choline, a nutrient essential for metabolizing fats and preventing liver fat. Build up lutein, a powerful antioxidant that protects liver cells, and over 13 vitamins and minerals, vital for liver detoxification and bile production. Eggs aren't harmful for those who eat them right. Each egg acts as a natural remedy, enhancing liver detox, clearing visceral fat, reducing mild liver inflammation, and boosting morning energy. The issue isn't the egg itself, but how, when, and with what you eat it. Eating eggs at the wrong time silently harms the liver. One of the most common modern habits is eating eggs first thing in the morning, right after waking. But Dr. Wareham warns that eating eggs at the wrong time can be a hidden enemy, damaging the liver over time, even if you're consuming a nutritious food. In the early morning, the liver isn't ready to digest eggs. The liver produces bile to break down fats and aid protein digestion. But after a night of rest, bile production is low, and the digestive system is in a slow start mode. Eggs, especially the yolk, are rich in complex proteins and fats, requiring coordinated liver and gallbladder function to process. Eating eggs immediately after waking, particularly before 7 a.m., when the liver lacks fuel, forces it to overwork, causing post-meal fatigue, sluggishness, strain on the bile-pancreas-stomach system, and over time fat accumulation in the liver. It's like revving a car's engine before it's warmed up. You risk burning it out. Morning combinations that overburden the liver. Dr. Wareham cautions that many unknowingly create a liver-damaging recipe each morning: fried eggs with hot oil, plus strong coffee boiled eggs with cold orange juice, or sunny-side-up eggs with white bread and industrial chili sauce. These combinations force the liver to work overtime when the body is just waking up. Coffee and orange juice, though beneficial, shouldn't follow eggs immediately, as they can block choline absorption, reduce fat breakdown efficiency, and stimulate gastric acid, causing bloating or liver heat. Best time to eat eggs. Dr. Wareham suggests the ideal time to eat eggs is after warming the body with warm water, light movement, or a small snack post 7:30 a.m., or during lunch when digestion is stable. Pairing eggs with green vegetables, ginger mugwort, or scallions enhances benefits. 5 mistakes that silently harm the liver. Eggs rich in choline, vitamin D, protein, and antioxidants are a true superfood, but prepared or eaten incorrectly, they can trigger liver inflammation and strain detoxification and metabolism. Dr. Wareham calls these silent mistakes because the consequences aren't immediate but costly over years. Frying at high heat. Frying eggs in oil hotter than 180-200 Gauss destroys choline lutein and vitamins producing toxic acrolein and aldehydes that inflame liver cells and oxidize cholesterol, contributing to fatty liver. Using cheap low-quality oil reused or low-grade oils, e.g. industrial soybean or canola, create free radicals at high heat, causing chronic liver inflammation and reducing detox capacity. Eating eggs without vegetables or fiber eggs lack fiber essential for liver detox. Eating them alone burdens the liver with protein and fat processing missing gut bacteria support leading to toxin reabsorption. Pair with antioxidant-rich vegetables like tomatoes, spinach, or bell peppers. Overcooking eggs, overboiled or over-fried eggs, gray-green yolks undergo iron and sulfur oxidation, reducing nutrient bioavailability, causing zinc malabsorption, indigestion, and toxic sulfide production, harmful to the liver. Optimal methods: soft-boiled, 6 to 7 minutes, lightly scrambled or steamed. Wrong food pairings. Combining eggs with soy milk causes protein precipitation, making digestion harder. Pairing with red meat sausages or processed meats increases protein load, risking mild liver inflammation. Eggs with orange juice or cold drinks hinder nutrient absorption and disrupt digestion. Dr. Wareham stresses, an egg is only as good as the meal it's part of. Wrong combinations turn nutrition into a liver burden. 3 groups who should avoid morning eggs. Many believe eggs are best in the morning for their protein and satiety, but not everyone should eat eggs then, especially when the liver isn't fully awake. Dr. Wareham warns, mornings are when the liver needs a gentle start. Loading it with a protein and cholesterol-heavy food like eggs at the wrong time or condition is like making it sprint before it's awake. These groups should avoid morning eggs to prevent long-term liver damage. Those eating right after waking. Many eat eggs immediately after waking for energy, but post-sleep. The liver's detox cycle is just complete and not ready for heavy foods. This strains the liver and pancreas, causing enzyme imbalances, bloating, or indigestion. Solution: drink warm water first, wait 20-30 minutes, or eat light fruits like papaya, banana, or apple before eggs. Those stressed or angry emotions affect the liver, known in traditional medicine as the organ of anger. Stress or anger constricts liver blood flow, reducing digestion. Eating eggs then with their protein and cholesterol overwhelms bile production, causing slow digestion, heat, or mild inflammation, leading to nausea, fatigue, or loose stools. Solution: take deep breaths, drink warm water, calm emotions, then eat. Those with liver heat signs, liver heat, mild inflammation, or toxin buildup, shows as bad breath, dark loose stools, dry mouth, discolored skin around eyes, or post-meal fatigue. Morning fried or greasy eggs worsen this, as a weak liver struggles increasing cholesterol and exhausting bile production. Solution: pause eggs for a few days, eat steamed vegetables, brown rice porridge, or bitter melon soup, and drink warm ginger or lemon water to cool the liver. How to eat eggs for a healthier liver. Dr. Wareham emphasizes that the question isn't whether to eat eggs, but how to eat them to benefit or harm the liver. An egg can be medicine or poison, depending on preparation, timing, and pairing. Here's how to eat eggs for a healthier, detoxed liver. Don't eat on an empty stomach. Eggs' high protein and fat content on an empty stomach trigger strong gastric acid, irritating the stomach lining and overworking the liver. Drink warm water or eat light fruits or porridge first to buffer the stomach. Minimize high heat. Frying in excessive or reused oil destroys nutrients and creates free radicals, causing mild liver inflammation. Opt for steaming, soft boiling 6 to 7 minutes or lightly scrambling with vegetables on low heat to preserve enzymes and antioxidants. Pair with cooling fiber-rich vegetables. Eggs are yang-warming, protein-heavy, so balance with yin-cooling vegetables to aid liver digestion and detox. Examples: tomatoes, bitter melon scallions, bell peppers, carrots, broccoli, mugwort spinach, or green beans. Don't eat eggs alone. Eating eggs solo, e.g., boiled with salt or fried with white rice, lacks fiber, overloading the liver with fat and cholesterol. Always pair with vegetables or ginger for smoother digestion. Frequency and portion. Healthy adults can eat 3 to 5 eggs weekly. Those with fatty liver or high liver enzymes, 1 to 3 eggs steamed or boiled. Kids or athletes may eat more, but must pair correctly. 1 egg daily is fine if prepared right, not fried with greens. Ginger as a catalyst. Ginger activates digestion and liver function. Drink warm ginger water 10 minutes before eating, or add ginger slices to steamed eggs to enhance bile production and fat metabolism. 9 golden food pairings with eggs. These 9 pairings with eggs are golden duos that cool the liver, reduce toxins and excess cholesterol, improve digestion, and maximize egg nutrition. Eggs plus. Bitter. Melon cleanses, liver lowers, enzymes purifies blood, prevents fatty liver. Try lightly scrambled eggs with bitter melon, or steamed bitter melon stuffed with eggs. Eggs plus tomatoes. Lycopene provides strong antioxidants, speeds fat metabolism, reduces liver heat and acne. Try tomato egg stir-fry or steamed eggs with tomatoes and ginger. Eggs plus bell peppers, vitamin C and flavonoids. Detox. The liver boost, immunity, reduce liver stress. Try 3-color bell pepper, stir-fry, or egg rolls with peppers and vegetables. Eggs plus scallions. Antibacterial aids digestion, helps liver clear excess protein. Try steamed eggs with scallions and ginger, or lightly scrambled eggs with scallions. Eggs plus broccoli. Sulforaphane supports phase 2, liver detox, lowers bad cholesterol, enhances liver enzymes. Try steamed broccoli with soft-boiled eggs or broccoli egg salad. Eggs plus carrots. Beta-carotene converts to vitamin A, supports liver function, reduces inflammation. Try carrot egg rolls or light carrot egg soup. Eggs plus spinach folate and chlorophyll repair liver cells. Detox heavy metals. Try spinach egg stir-fry or spinach egg soup with ginger. Eggs plus mugwort. Traditional herb, cools, liver balances, blood flow, aids digestion, reduces post-egg discomfort. Try mugwort egg scramble or steamed eggs with mugwort and ginger. Eggs plus green beans. Fiber reduces cholesterol absorption, stabilizes blood sugar, eases liver-pancreas load. Try green bean egg stir-fry or steamed eggs with beans. Tips for application. Don't eat eggs alone. Pair with at least one of these in every egg meal. Rotate vegetables seasonally for diversity, reducing liver strain. Prioritize steaming light, scrambling or boiling over high-heat frying. 5 signs your liver struggles with eggs. In modern and traditional medicine, The liver is the body's chemical processing plant, filtering blood, metabolizing fats, breaking down proteins, and detoxifying. Eggs rich in protein, cholesterol, and choline can overburden a weak liver, leading to toxin buildup and digestive strain. Dr. Wareham and experts highlight 5 signs your liver isn't handling eggs well, even one daily. Fatigue or drowsiness. Post-eggs, feeling sleepy, sluggish, or foggy after eggs indicates the liver can't process their fats and proteins, causing energy stagnation, potentially leading to fatty liver, high cholesterol, or post-meal hypotension. Thick white tongue coating. A thick, smelly white tongue in the morning signals the liver didn't clear toxins overnight. Eating eggs then may cause nausea, bloating, indigestion, or night sweats indicating liver overload. Loose, uncontrolled stools. Eggs require strong bile and enzymes. A weak liver produces insufficient bile, leading to loose, sticky stools. Post-eggs, a sign of poor fat digestion. Heavy, foul breath. Undigested protein and fat toxins exit via breath, smelling like rotten eggs, burnt fat, or fishy odors, indicating the liver can't process eggs efficiently. Dull, acne-prone skin. Eggs can trigger inflammation or hormonal responses if the liver fails to clear blood, causing acne-darkened skin, especially around the forehead, cheeks, or eyes, or a hot sensation despite cool weather. Dr. Wareham's key advice. When your body speaks after meals, listen instead of ignoring it. The liver doesn't hurt when damaged, but cries for help through post-meal sensations, breath, stools, and skin. Ignore these, and eggs become a burden. What to do if you have these signs? Pause eggs for a few days to rest the liver. Increase warm water, green vegetables, ginger, and daikon radish to cleanse the liver. Resume eggs using the guidelines above. Avoid frying and wrong pairings. If symptoms persist, check liver function, cholesterol, and enzymes. Conclusion: an egg's nourishment or burden depends on you. Over his 100-plus years, Dr. Wareham saw thousands live long, healthy lives by changing how they eat, not relying on drugs or technology. For eggs, a seemingly ordinary food, he saw both sides. Eaten at the right time way, and pairing eggs are a superfood for the liver, brain, and heart. Eaten carelessly, fried in smoke, or paired wrong, they silently harm the liver, raise cholesterol, and produce toxins. Eggs aren't the problem. How you eat them is. Reflect on this video. Wrong timing overworks the liver. 5 common mistakes turn eggs from nutritious to toxic. 3 groups should avoid morning eggs. Correct eating methods from water to preparation. 9 golden pairings make eggs liver-friendly, and weak liver signs require attention. The final philosophy: the liver doesn't scream, but it dies quietly. An egg eaten right nourishes, eaten wrong poisons. A wise person doesn't diet extremely, but eats with understanding.